Knock, knock. Hi, I'm Ellie. I'm going to be your student nurse from Clemson today, and I'm going to be performing a routine physical exam. Reporting my findings to my instructor, but please stop me if you have any questions or any concerns. I just want you to know I just washed my hands. I'm going to close this curtain to ensure your privacy. I'm going to start off by asking you, what is your name and date of birth?
Delaney Canton, June 4th, 1997.
Okay, great. I'm going to start off by taking your blood pressure. Will you just relax your arm for me, maybe on this pillow? I'm going to start off by doing baseline systolic, and then I will take it. It's 1 inch above the break of your elbow. Okay, great. Okay, great. Your blood pressure reports 122/76, which is within the normal range and within the normal findings. Next, I'm going to start assessing your skin. I'm going to start off by asking you, do you have any prior or current skin conditions?
No.
And do you have any upcoming rashes or bruises or lesions that I need to worry about? Okay, great. I'm just going to look around. Your skin appears even, smooth, and intact. I see no discoloration. Your skin's tan. I don't see pallor, or redness, or cyanosis. I don't see any lesions or rashes or edema. You have a few flat macules on your arms, but that's nothing to worry about. Next, I'm just going to check your hydration. I'm just going to pinch the back of your hand. Okay, great. The skin temperature check shows quick recoil, meaning you're adequately hydrated. And then I'm just going to assess your temperature by, will you flip your arms over? Using the back of my hands. Okay, great. Your temperature is even and warm bilaterally, and your face is dry, but your skin is moist and normal. And now I'm going to move on to assessing your lungs. I'm going to first ask you a couple questions. Do you have any family history of lung disease? And have you had any trouble breathing or nothing? Okay, great. Just going to look. So I don't see any nostril flaring or retractions or cyanosis or pallor, which would indicate chest pain, so she has no chest pain. And your AP diameter of your chest is less than your transverse diameter, which is great. Next, I'm just going to listen to your lung sounds. I'm going to start with your bronchial. Thank you. Just breathe a little bit heavier than normal, sorry. Your bronchial sounds are clear. Next, I'm going to do your bronchiovesicular. Your bronchiovesicular sounds are clear. Will you stand up for me just while I do the vesicular? Thank you. Starting above your clavicle. Okay, then will you turn around for me? Thank you. Okay, great. Your vesicular lung sounds are clear and symmetrical. And overall, there was no adventitious chest sounds heard, so no crackles, shudder, or wheezing, or rales, which means your lungs are healthy and in great condition, so that's awesome. Next, I'm going to take a look at your cardiovascular system. I'm going to start by asking you, do you have any family history of heart disease, or and have you been dealing with any chest pain or shortness of breath? None of that.
No.
Okay, great. I'm going to start by just feeling your peripheral pulses and just seeing how your blood flow. I'm going to start with your carotid artery. Then I move to your brachial. And then your radial. And then your femoral. Sorry, it's kind of... And then if you'll just stand up for me, your popliteal. And then your dorsalis pedis, which is on the top of your feet. And then your posterior tibialis. Okay, great. All of your peripheral lung sounds sound great and strong, 2+ bilaterally. Heart sounds. Next, I'm going to listen. I'm going to start with your aortic, which is located at the second intercostal space, right sternal border. And then your pulmonic, which is the second intercostal space, left sternal border. This is right sternal border. Herb's point, which is your third intercostal space, left sternal border. And then tricuspid, which is fifth intercostal space, left sternal border. And then mitral, which is fifth intercostal space, left midclavicular line, which is also where the apical pulse is found. Now I'm going to go back and listen to the same ones just with my bell to listen for any bruits. Okay, great. All heart sounds were found normal finding. S1 and S2 were found within normal range. S1 was loudest at the apex, and there was no extra heart sounds or murmurs or anything. Next, I'm going to assess your apical pulse for 1 minute, which is located at the fifth intercostal space, left midclavicular line. Okay, your apical pulse is 72, which is found within the normal range, which is strong and awesome. So that's great. Next, I'm going to assess your edema, which can be a sign of cardiovascular disease. I'm going to start with your ankles. Then I'm just going to assess your tibia. There is no edema present, so edema is 0. Next, I'm going to move on to assessing your abdomen. Will you lay down for me with your legs bent? Right. I'm going to start by listening. I'm going to start in the right lower quadrant and move up and around. Okay, great. There's active bowel sounds in all 4 quadrants. Next, I'm going to use my bell to listen for bruits. I'm going to start with the aortic, and then the renal, and then the iliac, and then the femoral. And overall, no bruits were heard, which is great. Next, I'm going to palpate. I'm going to start with light palpation and move towards deep palpation. Once again, starting in the right lower quadrant. I'm palpating for masses, tenderness, rigidity, enlarged organs, any of that. Now I'm going to move to deeper. Let me know if anything hurts. Okay, great. I did not palpate any masses, enlarged organs, tenderness, rigidity, so things are looking good. Did you feel any tenderness? Mm-hmm. Okay, great. Next, I'm going to palpate deeply your spleen and liver. And those are looking within the normal range. Next, I'm going to move on to your eye exam. I'm going to do so by using a pen light. Have you had any eye problems in the past?
No.
Any vision problems? Okay, great. Okay, so I'm just going to, will you just look forward for me? Okay, great. Your pupils are equal, round, reactive to light, and accommodate bilaterally at about 4 millimeters, which is within the regular findings. Next, I'm going to move on to assessing your neck, which includes all of your lymph nodes in your neck. I'm going to start by assessing your submental, and then your occipital, and then your tonsillar, and then submandibular, preauricular, posterior auricular, anterior cervical, posterior cervical, supraclavicular, and inferior clavicular. And overall, no lymphadenopathy was palpated, and they all seem easily mobile, non-tender. They're looking great. That's awesome. That means you're healthy. Next, I'm going to move on to your musculoskeletal exam. During this, I'm going to be just assessing your various joints for just the range of motion, their strength, if there's any crepitation, any strange movements, or lagging. And I'm going to begin. We're going to do a couple of different parts of your body. I'm going to start with your hips. Will you stand up for me? Will you walk just like 4 steps that way and 4 steps back? Great. Okay, so your gait seems smooth and even, and your iliac crest seems symmetric, which is within the normal findings. Will you lay down for me? I'm just going to have you do some range of motion exercises. With flexion, will you just lift each leg up one at a time? Great. And then will you bend your knee for me? And then we'll do hip flexion. Will you bend that into your chest one at a time? Great. And then will you bend your knee and rotate your toe inward and then outward? That's internal and external rotation. Great. And then will you stand up for me? And we'll do hyperextension. Will you just lift it behind you? Great. And then will you lay back down? Sorry, I'm making you. And then will you do abduction out, and then adduction towards. Great. Okay. So the range of motion of all the joints in your hips seem great. 5, which is within the best you can have. Full range of motion. Next, I'm going to assess your shoulders. Your shoulders seem even, symmetric. I don't feel any deformities, and they seem similar in contour and size and shape. First, will you do flexion, where you lift your arms straight out? And then extension. Great. And then will you do abduction straight up? And then adduction across your body. And then we do internal rotation, and then external rotation behind your head. Great. Okay, so all of the joints within your shoulder region have a full range of motion. You didn't feel any tenderness, or that's great. Okay, so next we're going to move on to your neck. I'm just going to look around. I don't see any deformities. It seems symmetric. You don't have any redness or swelling. I don't feel any deformities. That's great. Okay, will you do flexion for me and just look down? Then hyperextension and look up. And then just rotation. And then lateral. That's great. Okay, next we're going to do your elbows. Just going to check them out. They seem to be symmetric in size, and you don't have any bruising or swelling on either one. That's great. I'm just going to ask you to flex them and extend them. And no pain? Okay, great. Next, I'm going to take a look at your knees. They seem symmetric in size. I don't see swelling. You have equal and distinct concavities on either side of the patella, which is within normal findings. And I'm just going to ask you to just stand up and just go like this. Touch your butt with your ankle. Okay, that's flexion. That's great. No pain? Mm-mm. Awesome. Okay, next I'm going to take a look at your spine. Will you stand up for me? Your spine appears straight, and your head appears directly on top of it. Will you lean over for me in half? Great. Okay. So I don't see any scoliosis or irregular curvature, which is great. I have a couple range of motion activities for you. Will you just bend like side to side for me? Great. And then will you hyperextend it back? Great. And then will you just like rotate like you're going to crack your back? And then will you, let's see. Oh, I'm going to assess your sciatic pain. So will you lift one leg up? Great. Do you have any pain with that? Mm-mm. Okay, so all the joints in your spine appear to have full range of motion. You don't have any problems with that. No pain, no sciatic pain. Next, I'm going to take a look at your hands and your wrists. Just going to feel the joints in your fingers and in your wrist. Okay, great. Will you touch each finger with each thumb with your finger? Great, okay. And I don't see any swelling or abnormal coloring or redness. That's great. Will you put your hands into a fist? Does that feel painful at all?
Mm-mm.
And then will you flex and then extend? No pain?
Mm-mm.
Okay, great. The joints in your hand and your wrist have full range of motion at 5 and are looking strong. Next, I'm going to take a look at your ankle and your toes. Your feet, they look symmetric. I don't see any swelling or like discoloration. I'm going to have you do plantar flexion, which is point your toes down. Then dorsiflexion, point your toes up. And then eversion, out. And then inversion, in. Do you have any pain with those movements?
Yep.
Okay, great. So once again, you have full range of motion with those joints. Everything's looking good. They're all looking strong and at 5. Next, I'm going to take a look at your neurovascular system. I'm going to do so by asking you about various cranial nerves and asking you to do some tests. The first one I'm going to look at is olfactory. Will you close your eyes for me while I'm going to put 2 different smells in front of you. I just want to know if you can differentiate them.
Peanut butter.
Yes, good job. Okay, so your olfactory cranial nerve is looking like it's strong and intact. Next, I'm going to look at your optic nerve. Will you stand about where I am and just look at this chart and then cover your right eye first and tell me the third line of numbers?
2, 8, 4, 3.
Great job. And then cover the other eye.
2, 8, 4, 3.
Good job. Okay, so it looks like your optic nerve is intact as well. Next, I'm going to look at your oculomotor, your trochlear, and your abducens. What I'm going to do is I'm going to do an H motion, which is going to check your 6 cardinal movements. So you just follow my finger. Great. Okay, so those cranial nerves are also intact. Next, I'm going to take a look at your trigeminal. Will you clench your teeth for me? And then will you just move your jaw side to side? Do you have any pain or discomfort? Okay, great. So that is also intact. Next, I'm going to take a look at your facial. Will you smile? And then will you puff your cheeks out? And then will you like squeeze your eyes, kind of like you're in pain? Okay, great. No pain with any of that. Okay, so your facial cranial nerve is also intact. Next, I'm going to take a look at your acoustic. I'm going to cover one ear with my hand and say a word behind you, and will you just repeat it to me if you can hear it?
Dog. Mouth. House.
Yes.
Potato.
Your acoustic cranial nerve is also intact. Next, I'm going to look at your glossopharyngeal and vagus nerve. For that, I'm going to ask you to open your mouth and just say, ah. Your uvula is midline, which is within the normal findings, and those are intact. Next, I'm going to look at your glossopharyngeal. No. Next, I'm going to look at your spinal accessory. Will you try to shrug your shoulders as I push down? Great. Okay. Your spinal accessory cranial nerve is also intact. Lastly, I'm going to look at your hypoglossal. Will you stick your tongue out and just like wiggle it kind of side to side? Okay, great. Tongue is midline, which is also normal finding. So all of your cranial nerves are looking like they're intact and strong. Lastly, I'm going to assess your deep tendon reflexes. I'm going to start with your biceps. Will you just put your arm out for me? I'm going to hit right in the... Great. And then will you just put your arm like that? This is your triceps. Your reflexes are looking great. Next, I'm going to assess your brachioradialis. Great. And next, I'm going to use the flat side of this to, actually, will you sit on this? Sorry. So your feet are dangling. Great. Okay, next I'm going to hit your patella, for the patellar. Great. Next I'm going to do your Achilles. Will you dorsiflex your toes upwards and then flex your ankle? Great. Okay, and lastly, I'm going to do the plantar reflex. I'm going to trace the end of this across the bottom of your toe. Okay, great. So all of your reflexes are looking 2+. Bilaterally, everything's looking awesome. You had a healthy physical exam, and it was great to meet you.
Perfect. Thank you.